I never envisioned myself as a researcher, but I realized as I got into my training in geriatrics that I could do more good for more patients by doing research on the most effective ways to treat common conditions in older people and to improve care than I could by just practicing in a relatively small practice. And I think the opportunity to conduct research that has influenced the care of patients and influenced health policy in this country is just been an enormous pleasure for me to do. And I've been able to do research that has really influenced the way that patients are cared for in this country. And even to take it a step further, some of my research has been incorporated into health policy and regulations and standards for care. My research is focused on helping vulnerable older people. And so there's a concern about the benefits of the research versus the potential risks of the research when you get into vulnerable populations like I'm dealing with. What I'm trying to do is do what we call quality improvement research. It's a different category of research in which you can get a waiver of informed consent so that you're not doing anything to the patient or the caregiver that is experimental. You're not randomizing them. You're not doing really anything that's out of the ordinary in terms of clinical care. What you're doing is you're testing an innovative model of care compared to usual care. And so if you can document that the risks are minimal, then you can get the Institutional Review Board to grant you a waiver of consent. And that's what we try and do. And I was offered a really nice position to start a new program in aging and geriatrics in association with a new medical school. And you don't get that opportunity very often to really start something from scratch. So I'm very involved in developing the curriculum for first and second year students and delivering it. And I teach third year students in clinical settings in the hospital, in skilled nursing facility settings. If you do research that really influences the care of people and influences health policy, you can make a huge impact.